At the Swee Hock School of Public Health, we recognize the imperative for innovative approaches and novel solutions to address these pressing issues in an age of increasingly complex health, environmental, demographic, behavioral and social challenges. The telerehabilitation system is one such cross-disciplinary example, combining technological and public health expertise to alleviate a situation brought about by an aging population and fewer caregivers to stroke patients who need rehabilitation.
I had to learn a bit about engineering because I need to understand the equipment that they had, the algorithms and the systems, and my engineering colleagues had to understand a little bit about medicine. If we just depended within the paradigms that are within medicine, for example, if we just depended upon existing solutions that are available right now within the field of rehabilitation, we would not have been challenged to actually come up with something that was more patient-centered, something that more met the true and real needs of patients on the ground.
Public health of the future require people who are able to integrate, who are able to bring together different disciplines. There will be a lot of interplay with what's happening in the society, what's happening in the economy of the country, and this complexity will cause public health issues to be much more difficult to tackle in the years ahead.
The school has also impacted programmatic decisions in workplace health promotion. Together with the Ministries of Manpower and Health, the school has developed the Total Workplace Safety and Health Program, which was presented at the Singapore Budget 2014 and subsequently approved, to be rolled out in select workplaces across the island. In Singapore, the school's health promotion work cuts to the heart of one of the favorite national pastimes, eating. We work with our partners on projects to empower communities to eat right and add life to their years by preventing and delaying onset of disease, particularly diabetes.
Only giving people information about what is healthy eating is not sufficient. So we change what is being offered, or at least the Health Promotion Board changed what is being offered in the canteens and in the hawker stalls. Healthier oils, more whole grains, to make it easy for people to eat more healthily.
Beyond Singapore, the school is sharing its knowledge and expertise working with local partner institutions in Cambodia, China and Myanmar to develop capacity building programs in areas such as infectious disease management and control, workplace safety, and translational research methodologies.
The Swee Hock School of Public Health has incredible skills, both within the school and more broadly across NUS, that it can call upon, given its location and given its ongoing work in Myanmar. So the proximity, the skills, technical skills, but also interpersonal skills, being Asian, is incredibly powerful.
National University of Singapore, Swee School of the Public Health, နှစ်ခုကပူးပေါင်းပြီးတော့ကျွန်တော်တို့ရဲ့ကျန်းမာရေးဝန်ထမ်းတွေကိုပညာရေးတိုးတက်အောင်ဆက်ပထမအနေနဲ့ဆက်လုပ်ပါတယ်။ဒုတိယအဆင့်အနေနဲ့ကတော့ကျန်းမာရေးဝန်ကြီးဌာနအောက်မှာရှိတဲ့ကျန်းမာရေးပြည်ရှင်အရှင်တွေအားလုံးကို capacity building ပေါ့နော်သူတို့ရဲ့ပညာရေးတွေမြင့်မားအောင်ဆက်လုပ်ပါတယ်
Having witnessed more advanced breast cancer cases in Asia than he did in his last 10 years working in Sweden, including the Karolinska Institute, Associate Professor Mikael Hartman knew he had to go beyond the hospital and school to reach out to the communities directly. This took him on the long ride from Singapore to Sweden to understand firsthand the unique social, cultural and community-level factors influencing health-seeking behaviors in different communities.
Being located in Singapore, there's an infrastructure to do research. And it's located on the NUS campus, allowing for multidisciplinary work. So that makes it unique. It is well resourced, it has good connections, and it has reach to the regions. And that becomes essential if you want to do public health research.
at Swee Hock School of Public Health, our educational programs, we have students from a variety of disciplines, and we actually welcome any student from any discipline to come and attend our programs. Our programs tend to be also very practical, applied and transferable, so that our students can basically go out and be able to, confidently manage all sorts of public health problems in different contexts and situations.
My experience here at Swee Hock School of Public Health has been awesome. I cannot thank the school enough for giving me this opportunity, particularly the interactions with the many supervisors.
I realized that public health is quite a multifaceted issue and it encompasses a lot more. And maybe after I've graduated, I might be interested to pursue a career in public health.
I'm planning to go back to India, and then I plan to work with National AIDS Control Organization. And I'm also looking at the opportunities to work with World Health Organizations, especially in infectious diseases.
Well, along the way, in terms of my clinical practice, I come across many of the challenges from the public health perspective, asking myself in terms of the skill and knowledge built up, and that also motivated me to take up the Master of Public Health with the School of Public Health.
Public health development in Singapore has really achieved great strides in Singapore. I think it is very important for us to recognize that this goes hand in hand with the socio-economic development of the country over the last few decades. And all that we have achieved so far is really put us in a very strong position as a public health example of good public health development anywhere in the world.
The Swee Hock School of Public Health remains committed to our mission of turning discovery into healthier communities. Together with our partners and the community, the school continues onwards towards integrating knowledge across disciplines to develop translational solutions that will influence and impact policies and programmatic decisions to improve the health of generations to come in Singapore, the region, and around the world.